When I was in ISO or in jail, my HIV medicines were so sporadic that I even had to tell the captain, hey, I got to stop taking this because you know, it's doing me no good. In fact, it's doing me worse.
Louisiana has one of the highest HIV rates of new infection in the U.S. And within the United States, Louisiana's incarceration rate is nearly twice the national average. The same people who are very heavily policed in this society, people who use drugs, sex workers, African Americans, Latinos, people who are disproportionately represented in jails are also disproportionately burdened by HIV. In the parish jails, which are the county jails, people at risk of HIV or living with HIV are not getting the services that they need.
I was in there for about a good 3-4 days. Then finally they came in and told me that I would have to call my mom to send my meds because they couldn't get my meds for me. But then I couldn't call Mom because, see, I had been in there and I didn't have privileges to use the phone.
The sad part about many of these cases is that they're for very minor crimes, nonviolent crimes, small drug possessions, disorderly conduct, shoplifting. It's very important with HIV that you stay on your medication regimen and that you take it every day. And going to jail is one of the most disruptive events to your health when you have HIV.
As you take your medications, not only is your immune system getting better and able to take care of its own body, but you're also decreasing the amount of virus in your body, therefore making it less likely that you're going to spread it or transmit it to someone else.
I have clients that are in a cycle of jail, I'm out, back in jail, I'm out, I can't find a job or go back to jail. And in that cycle, it's nearly impossible to work with the jail systems to get that client their medication.
I sat in Orleans Parish Jail, I would say approximately 44 days before I received my first pill. But at that time, my body had become resistant to the medicine and I started getting sick. I had diarrhea bad. I couldn't hold nothing down. Like everything I ate, I immediately ran to the bathroom. I was vomiting real bad. I didn't see a doctor until I was released. And I was there for 7 months.
And once you are off your medications and develop resistance, then the cost of everything goes up. The testing goes up, as well as the medications that are available to you.
Now, HIV treatment is expensive, but under international human rights law as well as U.S. domestic law, it is an obligation on the part of the parish jails. Lafayette Parish Jail has developed a model for HIV testing that should be expanded throughout the state. Every inmate is offered an HIV test, and most inmates accept the offer. If they are then shown to be positive, they meet with the medical staff and develop a plan for obtaining treatment.
The bigger societal issue is that those individuals are all, almost 95% of all people go back into society at some point that are in jails and prisons. And without that knowledge of their condition, then they're spreading their disease to the rest of the public.
It is imperative that Louisiana parish jails implement a routine HIV testing program for inmates and make sure that they have a system for connecting that person, if they test positive, to care in the community.